welcome to And So Much More. I am your host, Cami Smith, and I actually have two guests who I love that they're here right now. They've both been on before. We have Tiffany Little, who's over patient education here at Centra, and then we have Mr. Lance Dorsley, who we don't get to spend as much time with very often, but he is over infection prevention. Thank you guys both. I know you're so busy, and I'm so thankful that you're here.
Thank you for having us.
So we're going to have a super awkward conversation, and we're not going to make it awkward. We're going to be talking about sexually transmitted infections today. And it's like the thing that nobody wants to talk about. Right. But it's also so impactful in our community, so much more so than I think anybody realizes or wants to admit. So we just kind of want to educate and bring things to the surface. And so just kind of join in the conversation with us. But first, why don't you guys tell me both a little bit about what you do at Centra really briefly before we jump in.
Get you started, Tiffany.
Sure. I'm over patient education, so anything that goes out, we make sure that it is relevant to our communities and that it is meeting health literacy standards and translation standards. So we would just want to make sure that everything we put out there is really approachable and meaningful.
Yeah, I love that.
And I'm over the infection prevention department for Centra. And really what we aim to do is make sure, patients aren't leaving the hospital with anything they didn't come in with. Preventing hospital-acquired infections, preventions during surgery, and just making sure that we're following, all the best practices when it comes to creating a sanitary environment in the hospital.
Yeah, I love that. And then I feel like both of you also are very good at staying in front of some of these information and sometimes misinformation based things that are floating through the media and social media. And so, I think everyone thought monkeypox was going to be the next COVID. And I know we had a conversation about that a few years ago. But then, the whole West Nile and the mosquitoes. And, these are things that are a concern, but it's how do you pull the frenzy away from what is real and what do we need to know and what can we let fall away. What information is just not true. And this is also one of those topics that you don't really see floating around so much on social media. But Tiffany, I know that one of our business partners had let us know that you were talking about just how prevalent this is in our community. So can you share a little bit about that?
It is. Actually, I'm going to give this conversation over to Lance because what we create a lot of our education based on the main reportable diseases or reasons that people come into the hospital because we want to get ahead of that. If people are coming in and they're sick, how can we prevent them from being sick in the first place? How can we help people live their healthiest lives? So based on the 2023 most reportable diseases, which I'll let Lance talk about, that's where we create our material, and that's why we decided that we really needed to start talking about STIs.
Okay.
Yeah, awesome. Really, as Tiffany mentioned, when it comes to reportable diseases, STIs, chlamydia, gonorrhea, they're always one of the top 3 throughout our state, along with other things, that are on the rise. Alpha-gal right now, something that just became a reportable, that we're seeing a lot of it in the community. We're learning it's a lot more prevalent than we thought.
Wow.
But when it comes to STIs, particularly chlamydia, gonorrhea, those are our top 3 reportable diseases for our region.
Wow.
Again, a lot of it we find, asymptomatic infections a lot of times. So folks aren't necessarily presenting with symptoms every time they get infected. So they might, pass it down to multiple partners down the road. And by the time, they end up in the hospital, they might just be at high risk, and then end up getting screened and, find out that they're positive for an STI. So it's definitely prevalent in the community.
Okay.
Even just looking at some of the Virginia Department of Health data, you'll really get a good idea of how prevalent it is, a lot more than we like to think that it is. Again, even looking at the data, you see disparities across minority groups as well. You see high-risk individuals as well showing up and being the ones, with the highest burden of a lot of these diseases. So we definitely have a lot of work to do. I think education, what Tiffany's team does, is critical to really get in front of this.
Yeah.
Many of these diseases are also silent. They
Oh,
go
okay.
undetected. So a lot of times people may not know about them, and because of the sensitive nature of a sexually transmitted infection, people don't want to talk about it, or they talk about it with someone that they love or they know pretty well. This may not be a healthcare professional, so that's where some of the misinformation comes from. You can look up anything on the internet, but it doesn't mean that it's true.
Yes, and also can lead to a rabbit trail of a direction that may not even be helpful for you.
Right.
So I want to talk about the data that you mentioned because as I was doing some research, it's growing. Like the data, the numbers are growing.
Yes.
What is the most recent data pool for what we know right now concretely? Is that like 2022, 2023?
So usually about 2022, 2023 is
Okay.
where we're at. We report, STIs, most of them, gonorrhea, chlamydia, HIV. They're mandatory reportables for pretty much every health department in the country. But, they then they collect that data, aggregate it by zip codes, and, make sure that, they are not duplicates and whatnot. And then there's usually a gap. So right now, the most recent data we have is really 2022, 2023 data. Might have a little bit of 2024.
Yeah.
But what the Virginia Department of Health does, they publish an annual report for us for STDs, chlamydia, gonorrhea, syphilis, congenital syphilis as well. And I think maybe one or two others. And it usually shows a 5-year trend. And if you do look at those 5-year trends, what I encourage you to do, you see it's been on the rise. COVID, the pandemic, has definitely influenced a lot of the numbers that we're seeing. Yeah.
Will we ever see the end of the impact of COVID?
We may be looking for these answers for years.
Yes. It's unbelievable. And, I mean, some of the things that we're talking about are, like you said, they're silent. And so when it comes to starting, like because the numbers, or the ages rather, 15 to 49, like, I don't think the average 15-year-old is thinking, I should probably get tested for something. And so when you talk about the need for education, like, what does that look like? Where do you start?
So by educating and putting education out there, that's really the first step, because we really should be having these conversations with our healthcare providers and our loved ones about what we're seeing and feeling and what we're experiencing. Syphilis, gonorrhea, chlamydia, those are our top threes. We really try and hit those hard, but they can be silent, and one of them actually has a latent period that can last 10 to 30 years.
Oh my goodness.
It stays completely silent in your system, and you may not know you have it.
Can you pass it on while it's dormant? Oh, okay.
You can pass it on to your children, or you can pass it on to your partners. And so starting with the conversations about having safe sex, no matter what type of sexual activities you're engaging with, having that safe conversation with your partner, and talk about your history, talk about the things that really matter, not just sexually, but also, the potential for diseases and for infections.
Yeah. So because we're talking about some really young ages, if there are any parents who are watching, what does that look like? I mean, do you take your child to the pediatrician and have this conversation? Do you take them somewhere else? Are there some tactics in place for providers to maybe have these conversations with younger patients outside of maybe having a parent present, where they may not be so inclined to share? So, like, how is that addressed?
Yeah, it can be a really sensitive topic, because we can feel very insecure about our sexuality or our gender. And these conversations have traditionally not been ones that you have around the dinner table,
Yeah.
So there are places that you can go, and there are places for our providers to go as well to help them have those conversations with their patients or their loved ones. So the health department does a really amazing job, not only equipping people to have safe sex, but also to give them information and dismantle some of that misinformation that's out there. The World Health Organization and the CDC both put out information on how providers can have conversations with their patients and with family members of patients too, because these topics can be hard to navigate, but they don't have to be. So there is also education on how to have those supportive conversations, because we do want to open the doors, because as we open doors and have conversations, we are eliminating risks.
Yeah. This might be a bit of a rabbit trail, but I mean, you think of our patients, and it's never just one area that is touched by a patient when they come in. It's often different service lines that they may interact with, but also ahead of it, like I would hope that my kids would be able to talk to me about these things, but something that we've chosen to do is we don't have a lot of family in the area, but we have chosen and really developed relationships with adults that we trust, and we have very intentionally encouraged the relationship between them and our kids as well. So, maybe they may not be so comfortable coming to me about something, but maybe they'll go to Miss Carrie, or maybe they'll go to Mr. Peter, or these people in their lives who, we want there to be a safe space somewhere. And so as you are talking to, people who could be potential patients, there's so much education there. But what about some of that ahead? I mean, I guess that might fall under prevention in a way, but what does that look like? Like to start, because I know you do a lot of encouraging conversation in the community. Like, let's talk about this more and encourage all of us together. So how would you encourage that type of environment?
There's a lot of freedom in being evidence-based and data-driven.
Yeah.
Because you don't have to make up the answers then. You don't have to make up storylines or even feel afraid that what you're saying is incorrect.
Yeah.
Because we know that the evidence supports that not talking about things does not lead to prevention. Mm-hmm. So having open conversations, even if they feel uncomfortable, it's okay. You can come at it from a clinical standpoint. You can have the data behind you, and you can say, I'm not here to judge anything that's going on. Who you are is who I love, and we're just going to have this conversation.
Yeah, I love that so much. And it's so important, no matter what age that you are, that whether it is an adult, like a trusted adult in your life, or your parent, or if it is your provider. We talk on this podcast all the time about the importance of a direct relationship with your primary care. And telling them what's going on. And we had actually a great conversation with one of our primary care physicians, and they talked about, tell us the truth, please. We want to be a part of, your growth in your life and your healthy aspects of your life, but we can only help you as much as you let us in. And so, those conversations are so vital. And early, you can catch things a lot earlier if your primary care provider is already on that journey with you. They can notice the changes that are happening. Go ahead.
They can also help support you in wherever you're going from here. If they know the truth, they can help support you on how to prevent whatever risk factors might be coming with that, or help support you in how to navigate it better.
Yes.
And I think those relationships with the providers is key, because there's a lot of misconception out there, especially among younger individuals at 15 to 24 age group. A lot of it, they think, hey, I'm a virgin. I've never had sex before, so I'm not at risk for an STD. But, provider can be there and say, hey, wait, let's define what being a virgin actually means to you, because, oral sex and anal sex, and there's just sexual contact can lead to transmission of diseases and be asymptomatic at all. So a lot of these STDs, we like to think of them as just affecting, our reproductive systems or genital area, but they can spread to our throats, our mouths. Gonorrhea in particular can spread from the mucous membranes down to other body sites, even causing, arthritis, showing up as arthritis in some cases, or meningitis or other parts of the body. So being able to have a provider where you can go to as a true source of, hey, I can trust this individual. He's he's my primary care physician. I seek care from him. And establishing that trust, I think that's important as well.
Yes. And that was going to be one of my questions, what are the symptoms? What do you look for? And I know the answer is, have the conversation. But, for people who are this isn't that big of a deal. I'm going to wait. Or, what are the symptoms? What can you look for? And then maybe what are some things that are mistaken as symptoms or as things that you shouldn't worry about?
So it's interesting you bring up symptoms. The majority of STI infections are asymptomatic.
Right.
crazy. Like you were talking about the
They're
silent.
silent.
So when we do talk about symptoms, we're talking about the minority of individuals that do get infections.
Okay.
Add to that too, a lot of the symptoms, they're the same across most of the diseases, gonorrhea, chlamydia, and you get the discharge as well. In men, particularly, gonorrhea may not be as men and women, actually both, might not be as symptomatic at all.
Yeah.
So the usual, that folks are used to hearing about, the penile discharge or the vaginal discharge, burning. But those are some of the common
pretty
obvious
rare.
signs. Yeah, but you can also have a fever,
Yeah.
and you might think,
And how many times do we shrug off a fever?
you get
it's-
Tylenol or some
Exactly,
ibuprofen.
exactly. Take a nap.
It can look like a lot of things.
Yeah.
You will have the discharge, you will have the burning with urination, but that's not always. And then syphilis, it can be a sore or an ulcer somewhere on your body that may not hurt at all.
Yeah.
And that's only in the first stages, and they may not happen right away. So a lot of people think that they've had sexual contact, that something might happen right away. They'll know right away. And that can oftentimes be 2-3 weeks, sometimes months, before they actually demonstrate any symptom at all.
Yeah. So is the message, if you're choosing to be sexually active, no matter your age, start testing? And how do, like, if I'm a patient, do I just go to my primary care and say, hey, I would like to be tested? What does that process look like? Just to kind of break it down for someone who needs a very simple, what do I do right now?
So always practice safe sex. Always. Any sexual contact. And like Lance was saying, it's not always, it's not always the sexual activity that you expect. It can be oral sex.
It's not
it can
always
be
intercourse.
Right.
Yeah.
It can be any means by which we have it. So practice safe sex anyway.
Okay.
If you do want to be tested, there are lots of appointments available through the Virginia Department of Health.
Okay.
And we have a location here in Lynchburg and some of our surrounding areas.
Okay.
You can go there for testings. No questions asked. They will even help equip you with condoms, dental dams, or whatever you need to stay safe. And then you can also go to your primary care provider. Now, sometimes those appointments can be far off. You can go to urgent care or to our clinics and be seen right away if you have concerns about being tested. But have those conversations early with your partners, about, what is safe and what is, where your boundaries are. It's always healthy to have boundaries.
Yes, that's so good. We talked a little bit about this earlier, but when it comes to like treatment, and what you all, actually both of you have said is, some of this will stay a part of your life for years, whether you know that you have it or not. So, are there treatments? Are they? What's the word I'm looking for? Sorry. Effective. Yes.
Yeah.
So, are there treatments? Are they effective? What can somebody do if they find themselves?
Yeah, so there are treatments. Gonorrhea, chlamydia. There's antibiotics that we can give that work very well. HPV, we have vaccinations to prevent HPV disease, which could lead to cervical cancer down the road. Syphilis as well, you can pass it down to the baby as well. So we do have treatments that are effective, not for all STDs, HIV, again, we have treatments that are effective, but we don't necessarily have a cure. To cure something against a lifelong disease that you'll be battling with. But the difficult part is a lot of these infections, again, are asymptomatic. So folks don't necessarily say, I'm fine, it's been 3 months.
They shrug it off.
Yeah. So they would go a lot of times without seeking treatment until by the time they eventually make it to see a provider, the disease might have already progressed, or it might be more difficult to treat at that point than if they would have caught it early. The other thing we're seeing as well is, there's emerging resistance with a lot of our existing antibiotics for STI. So, what's effective today may not always be effective down the road.
Okay.
So, that's kind of where we're at with the treatment right now.
This is kind of an ever-evolving situation, it sounds like. As with most, I think that, things are just changing. But I think that more conversation can only help. What type of research if you guys can speak to it, is being done? If things are changing and treatments are becoming ineffective over time, what types of research is being done surrounding this?
Anything that's being treated by antibiotics can develop resistance. Any bacteria are very smart. They know how to continually adapt, and it's actually really fascinating what bacteria can do. But because anything that's treated with an antibiotic can develop resistance, we're always vigilant. There's a lot of research being done on how to stay ahead of the bacteria and what they can adapt to.
Yeah. So we've kind of covered everything, but I do want to ask either of you, like, is there anything like pressing, like that would be important to share, or something we haven't covered that you think should be a part of the conversation?
I think the most important part of this conversation is that by not talking about it, you're not preventing it. The evidence never demonstrates that. Talking about things actually helps eliminate some of the risks.
Yeah.
Because with knowledge is empowerment,
Yeah.
right? We become more empowered to know what we can and cannot do to stay safe and to stay healthy. We do know in our area that there is a massive uptick in STIs, syphilis being one of them. The Virginia Department of Health does put out information pretty frequently about the uptick in, just syphilis alone is at a 5,000% uptick in Virginia, which is really a lot. And I keep thinking, if somebody had a conversation, if someone had been open and talked about it, or had known how to practice safe sex and felt comfortable with it, setting those boundaries and saying, this isn't for me, how much could we have prevented? But now, when we know about syphilis, oftentimes it's very late stages because, as I said before, it's silent.
Yeah, and it's when they can no longer ignore it. They can no longer push it aside. They have to come in, and that's too late to come in. Still come in, but I think that's important for our listeners to really take note of, those who are watching in Virginia. Like, it is here. Like, this is not something that's happening in California. This is not something that's happening outside of where it can impact you. Like, it is here, it is prevalent, it is growing. So it's important to educate and prevent and to be a part of these conversations.
Yeah, and I think kind of off the heels of what Tiffany was saying, even us in healthcare, it's really just changing that perspective, removing that stigma around talking about it, going from more of like a disease model to more of like a health model. Like, let's promote sexual health. Outside of the individual, impacts that STIs have. There's a big public health impact. That they have. They facilitate, transmission of HIV throughout a community. They have, dire consequences for babies and maternal health as well. So it has a lot of negative impacts to our public health throughout our communities. And the more we can remove that stigma and stop looking at it, these are diseases. Whereas these are infections. A lot of times just asymptomatic infections that can have consequences. So how do we promote better sexual health? The same way, we've done the shift around mental health and talking about that more. How do we get sexual health to more of that state? And I think that's a challenge for us in healthcare right now, and public health workers and community health workers as well, especially with our younger population.
Yes, and when I think about that younger population, I think about where we are geographically. Like, we are in a more religious area where sometimes these conversations are either taboo or they're just rejected because they're like, no, we don't need to talk about that. And it's so important to equip our kids who are going out into the world to know what to do in these situations. And so thank you both. You guys have just given us so much information. And I hope those of you who are listening dig in on this. And what are some resources that we can share? I know you mentioned World Health Organization, CDC. Yeah. Where can people find the most accurate information at this time?
If you're looking for information about what's happening here in Virginia, the Virginia Department of Health has some really great resources. Okay. I really think that the Centers for Disease Control and Prevention, CDC, has really approachable materials to not only help you have these conversations from either a provider or a parent standpoint, but also has information there too for finding out a little bit more about how you can protect yourself.
Yeah.
And I think the CDC, they do a good job of having a good social media presence. So especially for our younger population, CDC has Instagram pages, Twitter pages where they give out a lot of good information.
I love that.
Which is how a lot of our youth right now
Yeah.
gets their information is
Yeah.
from social media. So
That's so true. If it feels taboo to type it into Google, then just follow them on Instagram and let that just be a part of your scroll periodically and stay informed. Awesome. Thank you guys so much. I really appreciate your time.
Thank you for
and
having
thank
us.
you all for joining us on And So Much More.